When I look at my mentors in terms of my profession, infectious disease, I saw the battles they fought and won, eradicating polio, smallpox. This is my generation, this is my life's epidemic to cure.
I remember when PrEP first came out and I thought, oh my God, what are we talking about? Why are we doing this? You know, we got to do is find people and we got to test them and we got to treat them. And clearly preventing infection in whatever way we can is crucial. PrEP is a strategy of trying to prevent HIV infection by using medications that we actually use to treat people who have HIV infection. It will actually almost kind of like build a wall so that if they come in contact with the virus, that medication is on board in their body to fight that virus off so that they're not infected.
My challenge is educating our primary care providers who are on the front line on making this a priority, making this part of their preventative practice. Okay, you get your flu shot, are you a high-risk person? Are you a candidate for PrEP? It should just be part of their everyday encounter with patients on assessing their risk of HIV.
You know, I look back to when I was in medical school, and I'm not sure that, you know, a lot of time was spent on how to take an appropriate sexual history. So if people aren't wanting to breach the subject of taking a good sexual history, then the question of PrEP isn't going to come up unless the patient brings it up. And that's, again, why we're really trying to educate providers that, you know, this is part of routine care is taking a good sexual history. And if someone is at increased risk of acquiring HIV, you should have a good conversation with them about the risks and benefits of PrEP.
We need to do our job to make really low barrier, really accessible, really non-judgmental, confidential PrEP services available so that we don't have some of those same differences that we've seen in the rest of the country. And seeing on people's faces as they come out of the exam room with their healthcare provider, the relief or the happiness or the joy is really meaningful. What I really wanted to know is, for the lived experience of people who've been at risk for HIV for many years, what is it like to be able to have a sexual life where you are not afraid?